This is something we see in clinic, which we call it as raccoon eyes. A raccoon sign, or sometimes it's called as a panda sign also. And what happens is that there are ecchymosis in both the eyes, sometimes unilaterally and sometimes bilaterally. And there's a pooling of blood around the eyelids, and typically the eyelid margin involving the tarsus is spared. And it can be seen in the usually it's seen in my clinic. Patients with trauma usually come with periorbital ecchymosis, unilateral or bilateral, which appears as a raccoon or a panda. And the significance of this sign is that we have to rule out any anterior cranial base fracture. So there's the importance in it because we can always rule out life-threatening conditions. So what to do if you come across this kind of patients? The patient will obviously have a history of trauma. If there's no trauma, then you have to find other causes of the bleeding which has occurred and has pooled around the periorbita. So as an eye specialist, as an eye personnel, what the patient has to go is that patient has to go through all the examination, basic examinations of eye including vision, and we have after examination what we have to rule out is that we have to exclude all the injuries to the parts of the eye and the periorbita, not only in the eyeball but also the orbital bones and the orbital soft tissue. And in the eyeball, whether there is damage to the eyeball, whether there is an open or closed glove injury, we have to rule out any damage to the retina. So the eye examination should be very comprehensive. And if you are a general physician, if you are a allied health personnel, if you're a nurse, like mentioned before, always have to rule out uh, base of the anterior cranial fossa fracture. So it's a life-threatening condition. So we have to be always mindful that when the patient comes with this sign, uh, conditions like anterior cranial fossa fracture, base of the anterior cranial fossa fracture can come with this presentation. So as a health professional, we have to be always mindful and exclude the life-threatening condition. Uh, and basically, if there is nothing, no life-threatening condition or any injuries, major injuries, what we can do is that we can observe the patient, and usually this kind of condition, the periorbital ecchymosis, pulling out the blood around the eye, is usually it does resolve around 2 to 2 weeks, around 2 weeks, sometimes more than that. Thank you.